Dr. Budoff, what is cubital tunnel syndrome?
Cubital tunnel syndrome is when the ulnar nerve, the funny bone nerve, gets pinched on the inside of the elbow right here. This leads to tingling and numbness of the small finger. It can be the side of the hand, sometimes the ring finger. Usually worse when you bend your elbow or at night.
What causes cubital tunnel syndrome?
Cubital tunnel syndrome is a lot like carpal tunnel syndrome. Carpal tunnel syndrome is a space problem in the carpal tunnel of the wrist. Cubital tunnel syndrome is a problem with the funny bone nerve getting pinched by the elbow. It's a space problem. Many of us just genetically have tighter ligaments over the ulnar nerve at the elbow, and that compresses it. Sometimes it happens with age more or with trauma.
How is cubital tunnel syndrome diagnosed?
It's real simple. If you bend your elbow and your small finger goes numb, you have cubital tunnel syndrome. You go to hopefully a hand surgeon, fellowship trained. They'll do an examination, which is a variation on that theme. They'll confirm the diagnosis. Often we get nerve studies. I get them pretty routinely. They can be wrong 40 to 50% of the time. They're not that sensitive for it, but we get them routinely, and it's always good to get a baseline.
How is cubital tunnel syndrome treated?
Okay. So cubital tunnel syndrome, first thing you want to do is the easy thing. So it's worse when you put pressure on the funny bone nerve at the cubital tunnel. It's already pinched. It's already not happy. You don't want to make it any less happy. You don't want to lean on it like armrests, or if you're sitting at a desk, or if you're driving, you don't want to put your elbow on it. You don't want to leave it bent for a period of time. If you have cubital tunnel in your right arm and you're on a cell phone, you might want to use your left arm. If it's in both, you switch off, you get a Bluetooth headset. At night, we all sleep in the fetal position, crimped up. For the carpal tunnel, that'll crimp the wrist, and so you can use a wrist splint. Those don't work real well for the elbow. So what you can do is at night, when you're asleep, try to shove it under a pillow or wrap a towel around it so it doesn't bend all the way. If that doesn't work, try a 4 to a 6 week trial of that. You can either live with it. It usually does get worse. That's a natural history. It progresses over time, or you can get it released.
What can I expect after an endoscopic cubital tunnel release?
Okay. Let me just take a step back for a second. Older procedures like I had, like 20 years ago, where we moved the nerve, those are usually not necessary, only for people like me whose nerve subluxated and moved around. That's pretty rare, though, that's that big a problem. You can just get it released just like your carpal tunnel release. I prefer the endoscopic technique. The endoscopic release, it's outpatient procedure. They're relatively quick, 15 to 20 minutes for the surgery, and works very well. Lower complication rate, less pain, quicker to get back to activities and having the nerve moved, or an open release. Afterwards, you can shower after 24 hours, but do not get it dirty or submerge it underwater for 10 days. I use absorbable stitches. People like them. You just don't want to do anything too hard or too fast for a couple weeks. So if you're using a computer, feeding yourself, watching TV, you don't need anything. If you're around other people, they'll always grab your arm and hurt you more than you want. So you want to wear a sling around them, and also at night so you don't thrash.
Thank you for your time today, Dr. Budoff.
Thank you.